Okay.
How long are we going to go for? Sorry, I should have said that.
We're off now. We're already on, Chris. Doesn't matter. We can kick it off. That's all right.
Let's go.
We're on for about 30 minutes. Okay.
Yeah.
So what are we talking about today, Chris?
First things first, a very, very warm welcome to everybody that's taking the time to catch up with us, particularly warm. We've got another 30-odd degree day here going on, so it's nice and hot and steamy. There never seems to be any end of it. Interestingly, Aaron, just got back from my annual trip to Greece. Go there for 2 weeks in July every year, and we were actually rather surprised to realise that whilst we were out there in the first week, the temperature in Greece wasn't actually as hot as the temperature back here in Cheshire in northwest England, which was quite something. That's the first time that's ever happened. But anyway, we're here, and we're here to talk, I believe, about a topic which is actually very topical in the current environment, and that is that dreaded phrase, white space in the diary. Indeed. Not a week of my life goes by without me hearing that phrase. Is it the same for you?
Yeah, it is. And I have the double whammy of having a wife who runs clinics and learning first hand of there's white space in this clinic, Arun, what can we do about it? Okay. And we've tried lots of ideas over the years, and we'll talk about those later. But going back to your Greek trip, soon you won't need to go on holiday to Greece, will you? You'll just have to stay in Cheshire, and I think the temperatures, the latitude is changing. So,
well, the bizarre thing is, and it's actually quite ominous in a way, is that about 8 weeks ago, I did also my annual cycle trip with Sheila Scott. And Sheila and I have become very, very good cycling buddies, and some of our older listeners will remember Sheila as having a very long and illustrious career as a dental consultant. So Sheila and I met through dentistry, but we discovered a common interest in long distance cycling. We go all over the show. This year, we decided to do a route which is called La Vélodyssée, and it actually covers the French Atlantic coastal route from the Spanish border at Hendaye all the way up to Roscoff in Brittany. And the reason it's kind of really weird is that about 7 weeks ago, we were cycling through the Gironde, past Bordeaux, and up through that part of the world. And of course, now, sadly, I'm looking at the news headlines, and I'm seeing that the very, very territory that Sheila and I cycled through not so many weeks ago is now, of course, up in flames, and people are being evacuated.
Awful. Absolutely awful. And I remember going there many years ago with my kids, and it's such a beautiful part of France as well. Yeah. It's just tragic, and I feel so sorry for those people. But hey,
and it's a way, in a way, it's a kind of a quick, timely reminder that although we're discussing the issue of white space in dental diaries, let's just remind ourselves of
really not that important, is it? In the scheme of things.
In the scheme of things. But nonetheless, when you've got a business to run and when you've got bills to pay, empty surgery space is, an absolute catastrophe, because every hour of lost surgery utilization, and I think we've discussed this many times previously, Aaron, is that every hour lost is having a catastrophic effect on operating cost per surgery per day that we were talking about in episode 1, and ultimately it's impacting your bottom line. And so it's really important to do something about it.
So are you seeing amongst your client base, Chris, lots and lots of customers or practices seeing white spaces emerge further in their diaries at the moment, or is it just a universal you see every year? It's the same type of pattern.
No, I think that if we do a bit of a history lesson, of course, we had this crazy episode after lockdown, where there was a period that felt like about 18 months, 2 years long, where everybody was kind of in catch-up mode after the COVID experience. And of course, diary management was exactly the opposite of what it is that we're talking about now, because the concerns that clients were expressing 2021, 2022 were about not enough room to fit all the patient demand in. And of course, the circumstances have changed. And I think that when we look at I think the interesting thing for our conversation is to first of all spend a little bit of time thinking about the causes of white space in a dental calendar, and then as fast as we possibly can, let's get on to some solutions and some very, very practical tips and guides as to what listeners and watchers can do in order to deal with this issue. So let's talk about the causes, and I think that there's a macroeconomic cause and there's a microeconomic cause for white space in a calendar. And if we do, let's get the macroeconomic cause out of the way. So we do Iran, we do Ukraine, we do the Straits of Hormuz, we do wildfires in France and Spain. We can add, no doubt, many, many other issues around geopolitics and around geoeconomics as well.
I think, as you said, it's all based around fear ultimately, isn't it? Though people are fearful about the situation and all of those scenarios and many others, and therefore, do they go out and take up that treatment plan for that £4,000 Invisalign, or do they get those crowns done? It's that mindset, okay? And when there's an ounce of fear, and that perpetuates through society, which is very evident here now with a new government as well, and taxes are going up and all the things that you hear, it has that knock-on effect, okay? But you can't really change societal attitude. But if there's fear, there's fear. But slowly but surely, you've got to try your best as a clinic or as an organisation or as a business to overcome these barriers and to up your game, as you've always said, Chris. I remember you saying that in these difficult times, it means that the ones that survive are the ones who actually up their game, okay, and try their best to encourage those customers to come back, encourage to fill that white space.
And there is one comment that I want to make about these kind of macroeconomic influences, which is that, all right, we know full well that if you turn Sky News on, or if you listen to Radio 4 and you commute on the way into work in the morning or whatever, it's going to take you about 10 to 20 minutes to get really good and depressed for the rest of the day, because there is no good news, or what there is drowned by the bad news. And I've always had a phrase, and I remember I started using this phrase way back during lockdown, which is that as business owners and as team leaders and as managers, we have a responsibility to be a bit of a beacon of light, no matter how tough times are. So I'm not denying the seriousness of some of the factors that we've discussed. But what I don't want to do is to go into a morning huddle in the practice and somebody says, "Oh my God, have you seen the news? Look at what's happened now." And then you say, "Yes, isn't it awful? This is the worst flipping year that we've had since 2020. So don't take part in the bitch fest
conversation
that's going on. But at the same time, obviously, be realistic and say, yeah, you know what, guys and gals, I absolutely get it that there are a lot of challenges out there at the moment. And I absolutely get it that there may be more challenges in 2026 than we've had since the COVID era. But let's take a positive approach to this. Let's us be the beacon of light when we communicate with each other. And let's us also try and be the beacon of light when we communicate with our patients, to say, yeah, we accept and understand that we've got challenges out there in the bigger landscape, but we are adopting a very positive approach to this, and we are doing those things that are necessary.
Absolutely. And that goes,
in simple terms, be positive.
Be positive. And that goes back to leadership ultimately, doesn't it? It's the leader, as you said, that person in the organization, and it's you, and you might feel the burden of the problem, okay? But that doesn't mean you have to show the burden of the problem to the team. You may acknowledge it and accept it, and people might have concerns. They may want to talk to you about it, and that's absolutely fine to talk about it. But as you said, adopting a positive mindset can go a hell of a long way, okay, in turning around a negative situation. So spot on. I totally agree with you there. Language you use is everything, isn't it? Ultimately, the language you use.
And I am going to mention, and that I can see some raised eyebrows when I mention this, but you know, a long time ago in a galaxy far away, I did take part in a reality television show where a bunch of 13 guys were dropped onto a tropical island in the Pacific Ocean, and we were left there for a month. And of course, that, you know, is now history. It's a long time ago now. But I am going to say that when we got to the end of that experience on our very, very last night on the island, we had a little awards ceremony, just the guys. We did it all by ourselves. And Dino, who was one of the castaways, made some little palm crosses, and we handed out, everybody got a prize.
Sure.
And some of the prizes were longest beard, and some of the prizes were smelliest feet, and all the rest of it. But actually, they gave me the prize for being the most positive person on the island for the month that we were there. And that was unsolicited and very, very warmly accepted, because one of the things that I did all the way through that experience was that I just decided I wasn't going to be a negative person. I was always going to find a positive way through. And I think we all need to bear that in mind. Moving on, I think we need to then, sorry, Aaron.
Was that shaped by, because of you been having worked with dentists over so many years, that you framed yourself to be a positive person?
Yeah, absolutely, no doubt. I mean, you know, all I was doing basically was taking my job onto the island with Bear Grylls, and so it was just an all day at the office from that perspective. Although not obviously in many other ways. I think let's move on to the microeconomic.
Sure, these are the things we can actually influence.
While superpowers are throwing bombs at each other, what are the factors that are actually impacting on the ground floor? And one of the interesting things about that is that, and I'll be interested, Aaron, to see whether you have the same experience that I do here, is that very often when a client raises the issue of the fact that they're seeing an increase in the amount of white space in the diary, very often the client will jump to a bit of a conclusion, and they'll point a finger of blame either at an individual system that isn't working. For example, you know, our recall system is crap, and so that's why we've got white space problems. Or they might point a finger of blame towards an individual or group of individuals and say, well, our front of house team aren't performing particularly well, and so maybe that. Or a particular clinician's a bit of a miserable so-and-so, or so on and so forth. They'll start pointing fingers of blame. And what I found in my experience is that I'm going to talk about 5 factors that I think can contribute towards a white space problem. But the interesting thing is that when you do the deep analysis in a particular client's circumstances, you'll almost certainly find that all 5 factors are in play, and that they are all individually contributing and cumulatively contributing towards the fact that there is a problem. So let me do a real quick overview of those 5 factors in no particular order. All right.
Sure.
Number 1 cause is lack of financial due diligence. So this is your territory, Aaron, because it's a bit like we talked about in lesson 1, which is or episode 1 of this series, which is that you've got to have your finger on the pulse of the finances. You've got to know what your operating cost per surgery per day is. You've got to know what your clinician's average daily production is. You've got to know what your KPIs are. And if you're not on it with the numbers, it could ultimately mean that your pricing strategy is wrong. And it could ultimately therefore mean that your pricing strategy is one of the factors that's leading to the white space, because it might be, as you said earlier on, because there's a bit of a challenge on consumer confidence, it may be that a badly costed treatment plan is one of the treatment plans that's not being taken up properly. So there's the whole piece about finance. Number 2, very traditional, you've got a white space problem because your marketing systems are not on point. And no doubt in further episodes, we'll expand more upon everything that's involved in marketing. But whether it's your external marketing, whether it's your internal marketing, or whether it's inbound marketing, it's not quite on it. And so you're losing there. Number 3 is your patient journey. And so from front of house through treatment coordination, into consultation and diagnosis, through into treatment plan presentation and delivery, there's something that's a little bit off, something not quite right about the overall journey that you're delivering, whether it's the logistics of that journey or whether it's the hospitality that's involved in that journey. It's not quite right. Number 4, operationally, you're not quite up to speed. And one of the things that I'm going to make reference to is digital workflow, because proper digital workflow, the effective use of intraoral scanners, the effective use of diagnostic AI-driven X-ray diagnostic software, the effective use of note-taking, the effective use of report writing and treatment plan presentation using all of the AI technology that we've got will always increase conversion rates. And the fact that you're not utilizing those digital workflow systems is actually almost like holding your conversion rate back. And then I'm going to leave it till the very last that there might just be some people in your team whose interpersonal skills could do with a bit of a brush up. And it might just be that they are people who, again, are creating a situation where a patient's saying, well, I'd really like to go ahead with this treatment plan, but I didn't really connect with the clinician who I spoke to, or the treatment coordinator, or there was somebody in the team that gave me a bad hospitality experience. So all 5 in play.
I think I totally agree with all 5 of those points, but one more I would add to this is that we see it in our own clinics, my wife's clinics, but we also see it in other clients' clinics, is that certain dentists never have a white space problem, whereas certain dentists always do have a white space problem. Okay, and it could be, as you said, personality as one element of it, but it also goes down to the confidence that you exude to actually be able to say, I can deliver on that treatment. So I've seen this over the years where one dentist is fully occupied all the time, the other dentist is not, and they're doing similar types of treatment, but the patient buys into that personality, buys into that confidence, and then it's just down to the reception or the TCO team to kind of follow up and make sure that happens and goes through. Okay, but if you've got that wrong dentist, you can't really convince the patient. It's going to be a constant problem, and therefore these individuals need the right training, the right support, or they just may be doing the wrong type of dentistry ultimately, or they're in the wrong role, to be brutally honest with you. Okay, so I think that's another element to add. I think the patient journey, as you said, I know that's a term that you kind of coined over the years very, very thoroughly, and sadly, I still see so many practices where the journey is weak, and I think it's really usually in the follow-up is the key to getting these patients back into the practice to convert, to finish off those treatments that were sold. Because we're seeing increasingly more and more treatment plans being offered, but people aren't accepting them. What is the process to follow up? What is the system, as you said, to actually convince those patients to come back? And I think perhaps many practices don't even have a system. Okay, it's very ad hoc, or it's very random, or they have nothing, and no one ever follows up. So that's a real gap that we've seen in the wider marketplace, and technology can help you do that. We're doing that now with developing products ourselves to help clinics do that. Okay, to get those patients back through the door, because as you said, the white space is the costliest bit in the business. Okay, if you've got white space as an accountant to way too many dental practices, that is the thing that's going to make you lose money, and that's the costliest thing in practice. Okay, nothing else. Okay, and if you can fill that up, you don't need to worry about the marketing. You don't even need to probably think about external marketing, because you're getting those customers coming back. And I think the other point to add here is most dental practices have thousands of patients on their database. Okay, thousands. And maybe only 20% of those patients are actually coming through. What about the other 80%? Reactivate them, get them back in. What is your process to do that as well? So it's those internal marketing systems, as you've mentioned earlier, Chris, which are so important. Yes, you can have a recall system, but you've got to go beyond the recall system really to get those patients back through the door and encourage them to come back. So I think your points you've raised, the 5 are perfectly spot on. And pricing plays a really important part here. If you've priced the package wrong, or whether it's too low or too high, you get the wrong results as well. So it's a constant problem, as you said. Yeah.
Yeah. And I think what we've got to do is we've got to kind of move through into the solutions part of the conversation.
Yeah, I agree.
Say, okay, number one, we recognise there's a problem. Number two, we recognise that there are two causes for the problem. One is a macroeconomic cause. The second one is a microeconomic or micro practice management cause. Identify the fact that there are those 5 areas in which improvements could be made. And then, of course, inevitably, you've got to take action. Now, this is where very often clients suddenly become rabbits in the headlights, because what happens is that somebody like you or I come along and say, right, well, here's a list of 100 things you need to fix in your practice. Yeah. And, of course, everybody's already running around with their hair on fire trying to get through the day. And all of a sudden, Arun turns up or Chris turns up and says, well, there's some more work. And at the risk of sounding very, very cliched, we've really got to eat this elephant one mouthful at a time. And one of the ways that I try to approach this with clients is to say, okay, we might have 5 areas here that we need to look at, as previously stated, but let's actually say that, over the next 3 months, over the next 90 days, what we're going to do is that we're going to break that down into 5 fortnights. Yeah. And during those 5 fortnights, what we're going to do is we're going to have a little bit of a focus on each of those 5 areas. Now, in the first fortnight, we're going to review our finances and get the advice from people like yourself to say, let's make sure that the numbers add up.
Yeah. Just make sure you have the numbers firstly. I think that's that would be a start. That is a starting point. And way too many practices don't have the numbers. They're totally blind to get that right, and then get them right. That's the second stage. So,
and the one thing I would say about that is that there is really no excuse for not knowing your numbers anymore. Because number one, there are plenty of professionals in the marketplace that have got the systems and processes to help you to collect and collate those numbers. And also people like you and I, backed up by our own AI systems, can then actually process and analyze those numbers very, very quickly indeed. I can turn around a financial analysis report for a client now in less than 15 minutes. To do something that used to take me maybe a couple of hours poring over the numbers to try and understand what's going on. And that doesn't mean that we should all be dropping our hourly rates because AI is doing the work for us. What it means is that it's giving people like you and I more time to actually think creatively in the way in which we interpret this data and advice. So spend a fortnight reviewing your finances, spend a fortnight reviewing your marketing systems, spend a fortnight reviewing your patient journey, spend a fortnight reviewing your digital workflow, spend a fortnight reviewing your team and making sure that everybody's got those interpersonal skills, and just chip away at this in order to try to marginally gain improvements in the way in which the business is operating.
They compound, as you said, those little bits compound. But I think it goes back to one of the big issues that is very evident in the sector, though, is manpower, though, Chris. Okay, trying to find people. We can look at the financials, we can get the marketing reviewed, we can look at the technology, we can look at the patient journey. But then if I can't find the damn right person to join the team or be in the team, okay, that's a massive hindrance, okay, to doing any of this, okay. And that is a challenge not one clinic has, but virtually every clinic across the country has at the moment. How are your best performing practices overcoming that issue?
Well, the mantra is recruitment's a nightmare.
Yeah.
And the mantra is retention is a nightmare. And the mantra is getting people to perform is increasingly difficult. Now, if you buy into that, it will come true for you.
This is your positive mindset coming through. I can hear it. Yes,
it is yet again, and
I agree. I'm not being difficult, but I'm agreeing with you. But I just think sometimes you can't even find the damn person to hire. That's the problem. So, but anyway.
All right. So, and you know, I have had situations where I've had a client who was, I'm going to say gone through, sounds like a very unattractive term, but I've had a client who's gone through 3 practice managers in 12 months.
Sure.
And each one of the practice managers has passed the interview process, because when was the interview process any use? And what has happened is that they've arrived full of promise. They've then been given role and responsibilities, and the performance and/or behaviour has not been in line with brand standards. And so we've had 3 times in 12 months the client has come back to me and said, this isn't going to work. You know, this X Factor audition hasn't worked out. That's the real world, okay? Which is that I don't care how much psychometric testing you do or which psychometric testing system you use, and I don't care how many interviews you've done, and I don't care what your gut is telling you. The reality is that the only way that you'll find out whether you've made the right choice or not is 3 months after they join. Because it's only when you see them on the job that you'll realize whether you've made the right choice. Now, some people pick, and I always do describe it as an X Factor audition, because you've got to see a lot of really lousy acts in order to find one Harry Styles. That's for sure. And I believe that there is an element of recruitment that is very much like that. Hence the phrase, kiss a lot of frogs and fail fast. Sure. Because there is no foolproof system to pick the right people. And so once you accept that it is an X Factor audition, that you are going to have to see a lot of crummy acts, that it might well be that you put through somebody to judges' houses, but then at judges' houses, they don't perform as well as they did at the audition, so they don't go through to the final. Such is life. Yeah. Such is life. And think about football management in that context, and just count yourself lucky that you as a business owner have probably got more time to get it right than the average football manager has got. But we are facing the same dilemmas.
They get a nice big check though, Chris. There you go. So those football managers, one check and they can retire anyway, to be honest with you. So.
Yeah. True enough. But you know, you think about it. It's you can buy the player that's got the most amazing track record. They can pass the medical, and then they turn up and they play for your team, and nothing happens. Sure. And we both know that happens even in the Premier League.
That's across business. Business is like that is business, as you quite rightly said. Okay, but okay. So now going back to
let's accept the challenge.
Yeah.
And let's accept the fact that, yes, we've got to kiss a lot of frogs, and yes, we've got to fail fast, and we've got to keep on kissing frogs until our handsome prince turns up.
Okay. All right. Okay. So in order to get this white space issue addressed, okay, but what would we, you see so many practices, you know, so many practices over there. What are your, I know we talked about these 5 main areas. What are your kind of in practice tips that you would suggest people to implement if after listening to this webinar, this podcast? What would they be?
The first and most important one is that the biggest and most valuable asset that you've got in your business is your existing patient database, because those people have established a degree of trust with you. And it was very, very ably demonstrated to us during lockdown, where 96% of dental plan patients across the UK carried on paying their plan premium all the way through lockdown. Only 4% cancelled.
Yep.
And that was before we had the current media coverage of lack of access.
Sure.
So the most valuable asset that you've got in your business is your patient database. And so you need to have a good, long, hard conversation with all of your senior leadership team to say, what is it that we're going to do to, as you said, Arun, reactivate, but also to connect with our existing attending patients. First of all, to market to them the fact that we can still help them. And secondly, to market to them the fact that Professor Robin Dunbar at Oxford University tells us that every single one of your patients is connected to 150 other people. And so if you've got 1,000 patients, you're 1 degree of separation from 150,000 referrals. If you've got 2,000 patients, you're 1 degree of separation from 300,000 potential referrals. Sure. And it's the way in which you use that relationship and connect them and engage them as referrers that I believe is the number one most important thing that you need to do.
So on that note, have you got an example you've seen a practice that does that really well? Like how do they get those 150 people per patient?
Do you know what? It's really, really interesting. And I'm so glad that you've asked me the question, because this is where I get very, very basic. And, you know, in spite of the fact that we all wax lyrical about the digital landscape that we work in, the fact of the matter is that it goes like this. Imagine I'm the clinician, and Arun, imagine that you're a patient who is sat in the chair at the end of either an appointment or a course of treatment. It goes like this. Arun, just before we finish today, do you mind if I ask you a favor?
Yeah. Okay. And that favor is can you tell your friend?
And the favor is that we're looking for new patients in the practice at the moment, and we'd love to see more people like you, Arun, because we like you. So if I was to give you 2 or 3 of my business cards, would you be prepared to pass those on to any family, friends, or colleagues that you think would benefit from a visit to our practice?
Okay. All right.
Now, how old-fashioned is that?
Old-fashioned, and to me, as a recipient, you think, "Oh, okay, all right, I'm happy to help me. He's a nice guy. Yeah, I'll take some cards, and maybe if I see someone at some point, maybe I'll give a card." You're absolutely right. It's the basics, which are very, very powerful. Do you find that your clients do this, or maybe the practice owner might do it, but would the associates do that? That's another question. Okay, what's your experience? Of course they don't.
Of course they don't, and that's why it is necessary to have training and development and mentoring systems with the clinical team to say, we as a business, like everybody else, are in the middle of this white space challenge. It's in interest just as much as it's in our interest to keep your chair full, because when your chair is empty, you're not getting paid, and neither are we. And so we would like you to embrace this successful habit, and we would like you to start having this conversation with appropriate patients at the appropriate moment. And we will be checking in with you on a daily or a weekly basis to ask you how it's going. So as the business author Harry Beckwith famously said, there is no performance without accountability,
Sure.
And there is no accountability without measurement.
Yep.
So we measure how many business cards you hand out in a week. We hold you accountable to handing out a minimum number of business cards. And if you fail to do that, we performance manage you until you start doing it.
Sure. Okay, great.
Now, I could sit here for another 3 hours talking about all the other things you can do, because that would be a marketing course. But let's start with that simple, basic, human, natural intelligence, not artificial intelligence request.
Yeah. And you know what?
If I ask you,
and I remember you talking about this maybe 15, 20 years ago, okay, at this point. Okay, I've heard you lecture elsewhere and all these sorts of things, and that point hasn't changed, okay? And I think in many ways it gets lost in all the noise that is out there, okay, with AI and this and that and whatever, and people are busy in clinics. But it's sometimes, as you said, it's the simplest thing which are the most powerful. And it's a great reminder of what you've just said. Ask for the damn referral, basically. Yeah, ask in a pleasant manner.
Can I give you another example of this old-fashioned simplicity? And I was on a Zoom call yesterday with a super successful client, a female principal who I've worked with for over 10 years now. And she's just got an absolute Champions League clinic. And Monday morning call, Chris, I can't believe it. I'm seeing a bit of white space for the first time ever. This was yesterday morning, first day back from holiday. And she said, the other thing that is really worrying me, she said, I've got about a dozen treatment plans out there where we've done the mock-ups, we've done the treatment plan, we've had the patient in, we've done the pantomime, the patient has gone away, and normally they would have been back to us by now, and they've not been back to us.
Sure.
And she said to me, have you got any ideas on what you think I should do? And I said to her first name is Maria, and I said, Maria, here's what I want you to do. I want you to get yourself a really nice fountain pen. This is my Mont Blanc fountain pen. And I want you to go and buy some really nice stationery.
Sure.
And I want you to write each of those 12 patients a handwritten letter to say,
sure.
Dear Harry, gave you your treatment plan at the end of March, haven't heard back from you. We'd love to do some work with you. If there's any questions that you've got, if there's anything that could help, please give me a call. Would love to see you. Yours, Maria. Handwrite them, handwrite the envelope, stick a stamp on it, and get it posted.
There you go. Powerful. Great tip. Thank you.
And we came back from vacation at midnight on Saturday. And because we both work, we have a cleaner who cleans the house once a week. And when we walked in the door at midnight on Saturday, on the kitchen work surface was a handwritten note from Kim. Welcome back from your holidays. Hope you had a great time. Really looking forward to seeing the two of you next Thursday. Kim, kiss, kiss, kiss.
Okay. Very good.
You know what? I turned around to Annie, and Annie turned around to me, and we just looked at each other and said, we love this woman.
Sure. Yeah, there you go. It's that relationship building, isn't it? In action, really.
So one of my little soapboxes at the moment is that everybody's talking about artificial intelligence. I think that we need to remind ourselves about the opposite of artificial, and that is natural intelligence.
Yeah.
And natural intelligence is taking the trouble to write the letter.
That was very, very powerful, Chris. Well, we've been going over almost 40 minutes, so maybe we should start looking at wrapping this up, to be honest with you. Okay.
Yeah, sure.
So, right, any other things we wanted to cover today? I think we've pretty much covered it. It's ultimately that white space is there. We've talked about the macro points. We've talked about the micro environment. We've talked about these great tips of actually overcoming these by reenacting or reigniting patients through human interaction, as opposed to just pure AI. AI can help you do that, but ultimately it all boils down to relationships and people at the end of the day. Correct?
Absolutely, 100% correct. It's about relationships. It's about people. I'll say something really quickly. We just spent 2 weeks in Greece. It's the 22nd year that we've been out there. It's the second quietest year that we've seen on the island. The quietest year was COVID. This is the second quietest year. There were not as many people there this year as we have been used to. And a lot of our friends on the island, particularly restaurateurs, were telling us that they were having a tough season. One exception, and it's the restaurant that we take a 40-minute cab ride up into the mountains to go to twice every year. It's a restaurant called Mehra, Myrtia. They are the most expensive restaurant on the island. They are the most remote restaurant on the island, and they are the one that has the waiting list. You can't get in unless you book a table. And we know the owners well. We've known them for 20 years, and they are as busy as they've ever been. And there are two reasons for that. The first reason is the hospitality experience that they deliver. And the second reason is the quality of the food and wine that they serve. So let's just remind ourselves about quality and hospitality, because that's the positive differentiator, and there's always a market for it.
Okay, well, let's start wrapping this up, Chris. I know you said there was one book before we even got to this end of this call that you wanted people should read. It was called...
Great, thank you for reminding me. This is how to solve the marketing problem, and it's a book called Endless Customers by a fellow called Marcus Sheridan, and it is what I'm going to describe as the Bible on inbound marketing. I first came across Marcus Sheridan's work actually about 4 years ago. This is his second book, but this is compulsory reading for all of my clients, and anybody who is either listening to or watching this conversation, make a beeline for this. Because it has the capacity to be an absolute game changer. And of course, the other one, and I know, Arun, this is out of your recommend list as well, Unreasonable Hospitality, Will Guidara, is about how to deliver a hospitality experience that people will tell their friends and family about.
Right, Chris, thank you so much today. Okay, really insightful comments and points. The point about that human side is we're all too easily forgetting that, okay? And I think you've reminded me even to, well, there's some of the things I can do in my business as well. And you kind of forget. You just get so involved in the day-to-day, you kind of forget about the actually really important basic things. So really welcome that. We'll be talking about some other subjects in the next episode, I think, about patient journey, that type of thing next time.
Let me tell you, episode 3, we are going to talk about treatment plan conversion, and also how you can responsibly use artificial intelligence in order to improve your patient journey. So can't wait to get that one broadcast. And to everybody who's been with us, thank you. We really, really appreciate it. If you've enjoyed this conversation, tell your friends, because that's how we would grow. Arun, last word.
I think you just said it really, and you're a natural salesman here, Chris, and you're very good at this. You just did what you just told us earlier about asking for a favor about to a dentist, and you just did that here. If you enjoyed what you heard today, tell your friends. So thank you again, Chris. Appreciate it. Endless wisdom here, and we will see you all at our next podcast. Thank you.
Yeah, look forward to it. Cheers. Bye-bye.
Cheers.